Hello and welcome to our latest COVID-19 update. We're coming to you live from our London Assistance Centre, so you may well hear the phones ringing in the background, which are calls coming in from our clients, speaking to our medical and security experts. I'm lucky enough to be joined by Dr. Mark Parrish, and he will help us step through the current situation. So, Mark, a lot's happened over the last week. Perhaps you could talk us through what the current situation looks like.
Yes, a lot has happened. The key change in the last week really has been that the outbreak in China appears to be well controlled. And if you look at numbers coming from that, new cases flattening off, less and less new cases. Whereas what we are seeing now is more cases occurring in other parts of the world and outbreaks happening in other parts of the world, particularly three countries, South Korea, Iran and Italy. And that's been a change, hasn't it? Because we've always been focusing on China. The other thing we're seeing is a report that came out from the World Health Organization just last week after they visited China, which explains how the Chinese have controlled this outbreak. Extraordinary use of the traditional means of quarantining and containment, overlain with some modern technology and getting all of the local public involved, has made a significant difference and probably avoided hundreds of thousands of new cases of the coronavirus. So we see things starting to normalize in China and businesses starting to open, things starting to happen there, whereas in other parts of the world, and particularly Italy, Iran, South Korea, we're seeing large outbreaks which the local health organizations are containing. The one area that appears to be a bit more of a challenge at the moment is Iran, where if you accept that we have a 2% mortality rate, the numbers don't quite work out, and I suspect there's quite a lot more cases in Iran that we haven't seen yet.
Okay, thanks, Mark. And one of the things we're seeing as well is around the impact it's having on people who are potentially in some of these affected locations, who may not be able to get access to medical care locally, and calling us to get advice and assessment to support their medical care as well, separate to the COVID-19 situation as well. And perhaps you could talk us through a bit about some of the remote consultations and that aspect.
Yes, very much so. I think often we think that we'll arrange a number of things and we forget that we run a teleconsultation practice, put it that way. And a good example of this actually came from China recently, in fact from Wuhan, where we had a traveller who was impacted by the quarantining and the containment there. This individual is on some regular long-term medication and he was actually starting to run out of that because he hadn't expected he would be away for quite so long. He contacted us, we did a teleconsultation with him, assessed what he needed, and we were then able to contact a local pharmacy in Wuhan that was still open, and it was a pharmacy that we know, that we have assessed and accredited, so we know it's going to be providing good drugs, not fake drugs, and we arranged for him to have a resupply of his medications through that pharmacy. That meant that he didn't need to go into a local healthcare facility because they're a bit busy in Wuhan, and there was the chance he may then be screened for coronavirus and go down a route that he didn't need to go down. So we managed to contain all of that. This individual got his long-term medications and has remained in Wuhan and will remain there until the quarantine restrictions are raised. But it's a good example of some of the other things we do as well as the advice and the actions that we're better known for. That leads on, of course, to how businesses are managing these things, and whether with their travellers who may be caught overseas for a while. That's a challenge for some businesses. And then what we are seeing, I think, from all of the businesses that we talk to, James, about the plans and the actions they're putting in place for management of this, as it gets, I think a lot of businesses are thinking, okay, this is getting a bit closer to home now.
Yeah, definitely. And it's one that I think one of the major challenges that organisations are facing is around keeping pace with information. There is a huge amount of information out there regarding coronavirus. It's how do you ensure that information meets your needs? But I think taking it back to the key drivers, what are the decisions you need to make as an organisation? What are the decisions you need to make as an employee, as a traveller? And how do you then gather information to be able to make those decisions effectively as well? So it's all about understanding what decisions need to be made, who needs to make those decisions, and then be able to gather and consume the relevant information to help inform those decisions as well. That's a really key thing right now, particularly as it keeps changing and there is new information coming through all the time as well. I think another aspect as well, tied in with the information, is the internal education and awareness.
Yeah.
And I think organisations who are prepared to weather this storm are able to educate people on the risks objectively as well, provide them objective, actionable intelligence and information around the challenges, but also then make sure that there's very practical applications of that education as well. How they should handle themselves in the workplace, when they're travelling, before they're travelling, during travel, but also returning to work as well, and understanding what their requirements are there as well. And keeping up to date with that, I think, is very important. I think finally then as well, it's also around testing. Simulation exercises are a fantastic way, organisationally, to understand where potential gaps are as well. We run them ourselves within International SOS. Likewise, we recommend our clients do the same things, where you're testing to see where there are gaps, be that a case of someone displaying symptoms coming into your office, a impact on your supply chain as well. All of these aspects, if you test them, understand where the potential gaps are, and then build an action plan to fit those gaps. That's also a crucial aspect of being able to prepare effectively and respond as well.
Yeah.
And I think likewise, there are some elements on the medical side as well that I think that organisations can and should be doing right now.
Yeah, absolutely. So similar to what you described, the medical things are the same as this. What we are saying to the organisations that we advise on a strategic level is assume that you're going to get a case in your workplace, in your office, in your factory. Have you prepared for that? Have you run through your scenario? Have you got all the health things worked out? Do you know when to contact your local public health organisation, what they will do against what you will need to do? And can we help you make sure that's all working and is smooth, so when something does happen, we hope it doesn't, but if it does, you are all prepared. That sends a very good message to your employees and your staff. It means that you're much better prepared for managing that business continuity, which inevitably is going to happen to some of our organisations. And the advisors that we have in our team are spending all of their days talking to organisations about this.
Absolutely. Excellent. My thanks to Dr. Mark Parrish for his, as ever, valuable insights. As we've identified, this situation continues to evolve on a daily basis. So we do recommend that if you would like further information, advice or assistance in regards to COVID-19, please do not hesitate to contact us.